masculinization procedures are also done, and again, I'm very proud to say that those procedures were written up by my former predecessor and to some extent by myself more recently. So procedures that we might use to masculinize a face would include a number of different things, and it really depends on what the individual is there for. You might see a cisgender guy that just wants a really chiseled, like beefy jawline and a big square chin, and that might be all that we're looking at. So those would be on the list of things that we would do to masculinize a face. For the forehead, one can build what we would call a brow bossing using essentially a number of pseudo-autologous materials to build a brow ridge, for instance. People with a low hairline actually need a higher hairline if they want it to appear more masculine. People that are assigned male at birth tend to have higher hairlines than people who are assigned female at birth. You can lengthen a forehead. So those are a number of things. Additionally, we've done this, and this is less common for a cisgender individual, but for trans men, on about half a dozen cases, I've actually taken a rib and built a new Adam's apple for a patient. And when I first did that, I had no idea how people would perceive the result of that procedure. As happens anytime a new procedure is invented or a new technique is used in a different way, when we did the first masculinization procedures on trans men, it was a very slow trickle, and now we get asked for this quite a bit, and we're doing a lot more. So it's an evolving field, what we do for those patients, what works, what doesn't work as well, what procedures people have been happy with is evolving, but evolving in a very nice way, and I think we're making good progress. Having done it to a number of patients now at this point, oddly enough, it's one of the things that seems to be making most people the happiest of some of the things that we've done. So that's been kind of fascinating to me. It's something I didn't anticipate, and that's kind of what I mean, where we're still sort of getting our bearings about what is going to work for especially trans masculine individuals.